And you're all set.
Okay, good afternoon and welcome to the Health and Human Services Committee. Today is Wednesday, May 15th, and it's 1:00 p.m. I would like to call the meeting to order. Are there any changes to our agenda today? Okay, we have Susan Currie, Amanda Champion, and Travis Brooks is joining us via Zoom. Welcome committee members and welcome to our department heads. I would also like to welcome Josephine Gibson from the Mental Health Association, who's here to do a presentation. Let's see here. We do not have anyone here for public comment. Would you like to publicly comment? Oh. Okay. No.
I believe on Travis's desk actually is a public comment submitted.
Oh, okay. We actually have one written public comment, and I'm happy to go ahead and read that to everyone. Hello, members of the Health and Human Services Committee. Just to let everyone know, this is from Zachary Wynn. I regret not being able to attend in person to ask my questions. I hope my comments can be read into the record of the meeting and my questions posed to the committee so that they may be answered. Last month's public comment or public safety committee meeting included a discussion of a potential mental health stabilization unit in the county. It is my understanding that this effort is currently on hold with $1.5 million in ARPA funds currently set aside for this purpose. What individual or organization is currently leading up the effort to create a mental health stabilization unit? Is progress being made? What is the timetable to utilize these funds before they must be sent back to the federal government? Specifically, what is the deadline to use them before they need to be returned? On the issue of Tompkins County Whole Health Department opioid and overdose activities presentation, I would like to understand exactly what drugs people are overdosing on, specifically the fatal overdoses. It was previously reported that staff had tested over 100 samples of street dope, finding 100% to contain fentanyl and 74% to also contain xylazine. Has Whole Health documented any instances of the tissue necrosis that is associated with xylazine use? Has Whole Health or other institutions in the county documented any limb amputations that were associated with xylazine use? Also, I'm curious if the Tompkins County Mental Health Association update and presentation will touch upon the role methamphetamine is playing in the county as it relates to mental health issues. I know there is an opioid task force. Is there any similar focused effect to manage the issue of methamphetamines in Tompkins County? If there is not, would it be prudent to create a methamphetamine task force? Thank you, Zach Wynn. Thank you, Zach. And as far as the chair's report, I do not have a chair's report for this month. I know that we have a pretty lengthy agenda with a few presentations, so I wanted to make sure that we have time for all of those. And so the one thing that we do need to address is for our next meeting. It is on a holiday, and so we wanted to go ahead and reschedule that. And I wanted to check with committee members and see if June 17th at 1 p.m. was going to work well for everyone's calendar. Okay.
Yeah, that's fine.
Travis, does that work for you?
I am double checking now. I'll let you know in 2 seconds, but I think so.
Okay.
I'll let you know if it doesn't.
Okay.
Right now it does.
Sounds good. And Jordan, if we could write Randy and inform him of that as well.
Would that be at 1?
That will be at 1 p.m.
Okay.
Yes.
Thank you.
Thank you. Okay, next, let's go ahead and move on to the County Administrator's Report. And Lisa Holmes, County Administrator, is here with us today.
Hi, Shauna, thanks. I have 2 items that are tangentially of interest to this committee and also other committees of the legislature, but I thought I'd bring them to you. Just to make committee members and others aware that the county is working, county staff is working together with Human Services Coalition and Continuum of Care and the city on every other week meetings to discuss a lower barrier approach to shelter, and coming up with with the goal to come up with a plan, a timeline, and a budget to implement a mechanism to expand emergency shelter services to provide code blue or lower barrier access that would be on a scale that hopefully could be doable given the workforce and other constraints that we have in our shelter system, and you know, at a cost that could also hopefully be realistic and able to be considered by the legislature. So our goal is to try to come up with something by mid-July for consideration for the 2025 budget process. So that's one item, and I'll pause to see if there are any questions about that.
I don't see any, thank you.
Okay, then the second item, and also I was just informed this morning from a Recycling and Solid Waste Director, Leo Riley, that there have been a couple of concerted encampment cleanup efforts of debris in the encampments by the city. The second effort took place the first week of May. They brought in 32 loads equaling 118 and a half tons of debris. And taken together with the cleanup that took place earlier in the year, the total was 292 tons of debris and $28,000 in tipping fees. So.
Wow. Any questions or comments for Lisa?
That's a lot.
Yeah. I know, Lisa, I have been contacted. There have been some residents that live on Lagota Park who are experiencing syringes that are washing up on their shore. Can you talk a little bit about, or can Frank talk a little bit about what people that are having trash and debris and specifically syringes or hazardous waste, what can be done about that?
I would defer to our public health department on those questions.
Yeah, we've heard the reports. We're trying to understand if it's even possible for needles to have made its way from the encampment to Lagota Park. It does feel like the more likely source is something closer to the park. And, you know, we wouldn't be surprised to know that there's substance uses happening in other parts of the county. As far as being able to clean up, it is a challenge. We don't have a lot of entities that are able or willing to come out. I believe there is some information on our website, and I'll double check and confirm that, on how to safely kind of collect and dispose of those if they're found. But that's really, you know, all I have in the moment.
Okay. Let's see here. Is there anything else to report, Lisa?
That's all I have. Thanks.
Okay. Great. Next, we are going to move on to our presentation. And Josephine Gibson is here from the Mental Health Association. Hi, Josephine. How are you doing?
Good. How are you, Shauna?
Good.
Good afternoon, everybody. Thanks for having us. I also brought Jenny Miller, our COO, to help me with the presentation. I can't usually click slides forward and talk at the same time, so. Are you able to share your screen, Jenny?
Yes, I will be sharing my screen. Let me just pull it up one moment.
Let me just take an opportunity to thank legislature members for support so that the OTR was passed to help fund the Outreach Center. Thank you for your support, everybody.
Thank you. We look forward to seeing the great work you've been doing.
All right, so our goal today is to give you an overview of our services. I don't think we've done that in a long time. So give you an overview of our services, quickly talk about what makes us such a unique organization, and also talk a bit about the Outreach Center funding. So I'll start with our mission. As a team of peer specialists, we draw on our lived experience and specialized training to empower individuals, families, and groups through peer support, advocacy, and programming that promotes mental health recovery, early intervention, and the prevention of mental illnesses. Our services work to end the stigma of mental illness by encouraging open conversations and education. And it's pretty great that we're presenting today because it's May. May is Mental Health Awareness Month. Mental Health Awareness Month was actually started by Mental Health America, which we are affiliate of, in 1949, I believe. All right, but let's move on to the next slide. So we are a community-based nonprofit organization. This is our 70th year. We were established in 1954. We are one of 25 affiliates in New York State and one of 143 affiliates of Mental Health America. Our funding comes from New York State Office of Mental Health, Tompkins County, and donations and grants. All of our services are free. Some of our education programs are at cost, but we try to keep those very low, and we often get grants so we can provide trainings free for certain populations. So we are a peer support agency. And so what that means is that everyone here identifies as being a peer, a person who has received mental health treatment, has a mental health diagnosis, and has been on a recovery journey. And now they support other people on their journey. And as a peer support agency, that means everyone here is a peer, and our board also identify as peers. And I'm a peer. All right, our next slide, Jenny. So why a peer support agency? And that's what makes us truly unique. I think that we offer a level of acceptance and understanding that, we have been there, and it is truly unique. Our services, they don't replace therapy, but they often complement clinical therapy. We assist people on their own recovery paths without judgment. We meet people where they are and with what they need. And again, all this is done by staff who have their New York State peer certification. A peer specialist actually goes through a lot of training. They identify first as a peer having lived experience, but then there is a certification process. There is actually coursework that is taken through the Academy of Peer Services. There are 14 courses and 5 electives that you have to take, and there's testing at the end. You also have to complete 2,000 hours of peer work, and that can be as a paid peer or volunteer work. And then we also have ongoing education requirements. So we have to do continuing education peer courses. All right, now I'm going to get into our programs at MHA. So we have 4 main programs: peer support and advocacy, which currently is for adults 18 and over. And peer support and advocacy includes individual one-on-one peer counseling and support. We also, what makes us really unique is that we can go to meetings with people, assist people with housing issues, assist people with finding other services in the community. So it's a lot like case management used to be, where a lot of our peer specialists end up helping people get to where they need, assessing where they are and helping people get to where they need to be. Our peer specialists also run support groups, and I will get into those in a little bit. Work groups, training groups, specialized groups that teach people evidence-based practices for dealing with mental health issues, service navigation and advocacy, and of course we offer hope by modeling recovery. Our newest program is Justice Services. It actually started with a small OTR maybe 6 or 7 years ago that Frank helped us to get, and it was to go into probation and to the jail and to provide peer support in those places. It has since expanded. We do a weekly group at probation, which is really wonderful. But now we're also in the Ithaca Wellness and Recovery Court. We have peer advocates in that court system. That peer goes to court, is there for people to see, and then he makes follow-up appointments with people so he can provide one-on-one peer counseling and also get them engaged in our other services. Our psychosocial program, which we call Drop-In, is what happens in the outreach center, the place that was actually funded with your support. And that is a safe space where people can come in. They know that they're going to be surrounded by peers. And it's a social drop-in. You know, we have coffee, we have snacks. I don't know if you can hear people laughing behind me. But people play games and do activity groups, art groups together, learn from each other. It's a really wonderful program that just provides connection, which, as we know, is so important. And family support services it's actually a program that's been struggling quite a bit. It is a program that's designed to serve parents who have a child under 21 that is diagnosed with a mental health issue. And it helps the parents with skills, courses, support, advocacy. You know, someone might need help going to a school-based meetings, and a family peer can do that. Right now, we actually don't have a family peer. There are very few of them in the state. So it is a challenge area for us. But we do have a person in there who is not a family peer advocate, but she is a family coordinator, and she was a community nurse for 30 years. She actually developed the PCAP program, which prenatal care assistance program, I believe, about 30 years ago. And she has been going into people's homes and doing health checks for that program. And so she is very knowledgeable and has been doing work with families with at-risk kids for her whole career. So she's actually the coordinator of that program and works as a just to help people coordinate services and stuff while we're waiting to fill the position of a family peer advocate. Sorry, I'm going like so fast. Does anybody have any questions so far?
I think we're good.
Okay, I'll just keep going then.
That's great.
Another thing I wanted to mention, in Justice Services, we just hired a CERPA, which is a Certified Recovery Peer Advocate. So exciting. I've been at mental health for 24 years and we've never had this. We've always sort of left substance use to the substance use agencies. But we finally have a SERPA. And so that is a peer who has had substance use issues and has been in recovery. And so they are helping other people on their recovery journey. And so in July, we're starting a dual diagnosis support group. So we're actually going to be able to work with mental health and substance use together. All right, Jenny, next slide. This is just an example of some of the activity groups that we do here, or the peer-led support and work groups. The social activity groups fall under that psychosocial funding that I was talking about, and the peer-led work groups fall under the adult peer support. But these are some of the things that people are enjoying at our agency. And then there's many others that are always starting and stopping and starting. But that's just a little idea of what we do. We also, next slide. We also have a fabulous community education program. We provide mental health first aid training. I hope many of you have heard of it. And we also do, we can do presentations on request. So other agencies will call and just ask for presentations. We have a wonderful community educator, Melanie Little, and she will actually create presentations to deliver at agencies on a variety of topics that you can think of. She's actually developing a de-escalation training right now, and community education is available for individuals, for families, for groups, for businesses, schools, organizations. Yes, we are here. And then we have other current collaborations, like with the PROS program. I know we have our Justice Service Coordinator going over to the PROS program next week to do a little info session. And also one of the staff from the PROS program comes to our drop-in center once a week, I think. Jenny, does he come once a week or every other week? To talk about the PROS program and meet people in our space. Same with Challenge Industries. We have their mental health outreach worker comes to our outreach center, and he actually will meet with clients there, so his clients can learn about our services. We also have a great relationship with Cayuga Medical Center. We have 2 peer advocates who go up there weekly on Fridays to do an information group and talk about some of the services that might be able to be part of when they come out of the hospital. So they go up once a week. Sorry, I was just getting a message. And we also get direct referrals from hospital staff. So there's a really good communication between Cayuga Medical Center and our peer staff. We also have NAMI that's actually moved into our offices. So that's great because our family, we have opportunities for collaboration with their parents. And for example, another thing we just did too was we're working with NAMI on law enforcement training, and we just finished a 4-day, at the end of April, I think it was, law enforcement training. It took place in our outreach center. Again, thank you. And we had 34 first responders, I think they were mostly officers who came for mental health, wellness training, crisis training, and that was a wonderful event, and we're going to be continuing on with helping law enforcement to establish peer support for each other, peer support groups. We also work a lot with the Sophie Fund, They sponsor a lot of our mental health first aid trainings. We recently did a youth art show with them. And then, of course, we're always working with Cornell interns, work study students. We provided mental health first aid for the resident hall directors. Yeah. Okay.
Josephine, I just have a quick question in regards to working with law enforcement. Have you all been working with any of the new CARES teams that have been established by both the city and the county?
We have not been working with them. We have definitely had to call for them.
Okay.
And their services, actually, that was just last week that we had to do that. But yes, it would just be good for us to do that.
Great, thank you.
Thank you. All right, so some quick facts. I think sometimes it helps to look at numbers, right? So in 2023, we served 1,420 people across our programs. So that's unique individuals, right? And then we served those 1,420 people 8,210 times. Our staff, we are small and mighty. We have 4 full-time staff, and now we have 4 peer specialists. We're looking for 1 more that do all this great work. Feedback, we're always encouraging open dialogue from our participants, suggestions of how we can do better and gaps we can fill. All of our services, we ask people to complete surveys when they're done with, so we're constantly collecting lots of information. I guess it was 7 years ago, 5 years ago, we became a living wage employer, which is lovely. Formal intake. This process has actually just changed recently. We have formal intakes for our peer counseling. What happens is an individual requests peer counseling services. They will come in, they will meet with a peer specialist. The peer specialist will talk to them about all of our services that we offer to see if they want to continue. And if their second appointment, they will actually do an intake. The peer specialist will then work on them with, it's like a service plan, but we just say goal setting, something that they can work on, and then they will have 12 sessions. And the reason that we just implemented this is that we were starting to have a wait list for the first time for our peer counseling services, which, so we're now doing 12 sessions, and then we will reevaluate, but people might have to go onto a waiting list, which I'm glad people are finding us sad we're having a waiting list.
But we have services. If they're on a wait list at the time, they can do drop-in in our support groups and activities. So there is always an option for someone to receive service.
Yeah, 100%. There's a lot of other things to do. This is just wait lists for the actual one-on-one sessions. Yes, thanks, Jenny. And our staff participate, we have monthly collaborative supervision. We have weekly staff meetings. We have bi-weekly team meetings. We just had yesterday staff development day. And this year is actually a strategic planning year. So we're working on our strategic plan with our board for the next 5 years. We're gonna do a 5-year plan. So that is coming up next month. Staff, I think it's, one of us is working on their peer specialization, but 7 of us are certified. 3 of us are mental health first aid trainers, facilitators. 4 of us are certified RAP, which is Wellness Recovery Action Planning facilitators. That's an evidence-based practice that people can use on their journey. It's just tools of creating a plan to support yourself. We also have 4 mental health one-on-one facilitators, and 3 of us, 2 of us are training next week, so it'll be 5, but 3 of us are mental health community partner facilitators. And that, again, is a program that actually is 12 sessions where you work with people on goal setting, addressing triggers, warning signs, that kind of stuff, giving people real tools for dealing with their mental health challenges. And actually, that program was developed by Mental Health 101, and Mental Health Community Partners was developed by Mental Health Association of New York State. Let's see. Okay, next page. Challenges. So I think some of the challenges that we face is that it's very hard for us to have numbers of, a lot of times it's how many people did you keep out of the hospital, right? You're trying to look for those numbers that we can't really produce. We have a lot of stories. We have people who come and tell us how much we've helped them and how much we, people who will say that they're here because we're here. And we have these beautiful stories that we hear, but we don't have, we can't always show that, or we'll talk to somebody on the phone once and get them through a crisis, but then we don't know, down the road where they are. So it's very hard for us to show like reduced hospitalization or say that we kept somebody out of the hospital. So that's a big challenge when we're doing reporting. Also, peer work it's getting better, but it's just, it's a lot of people don't think of it as a professional work. And so there's a lot of stigma around it. And I definitely think it's getting better, but we still have a lot of work to do there. Also, recovery is not linear. So we are on our recovery journeys, and sometimes we might need a break from this work. We might need to attend to our mental health. And so staffing is sometimes challenging. And of course, funding, which, I put the history of the COLA here. I'm not really going to go through it, but basically you can see that we're supposed to have like 43% of COLA increases in the last 16 years, and 10% of that has come to, actually come to us. So one of the challenges is that, 10 years ago, we were paying people $8 an hour. Now our starting wage is $19.50, but our state funding has only gone up this 10%, but salaries have gone way up. So what happens is we have a smaller staff, people are working 110% and exhausted. And yeah, so here we are. What's new and upcoming? We have a name change. We are going to change our name from association to advocates. I think association has a very clinical ring to it, and advocates is more of what we do. So that name change is coming in this summer. We'll hopefully launch it in the fall. And then, of course, I said Better Together, but that just happened this weekend. I hope maybe some of you were able to attend. It was a wonderful event in Stewart Park. We did, this year, Jenny made an event page for Better Together, so you can actually look at it because it's an annual event. And yes, so that next slide is some testimonials. I think, Jenny, you pulled these off of evaluations, service evaluations. And that is the presentation. I went so quickly, I apologize.
No, that was great. Thank you. Committee members, are there any questions or comments? Amanda?
Well, thank you very much for all of that. That definitely a lot of information, but I feel like I have a better understanding of what you all do. And maybe you said this, but, and you talked about your staff, and is it hard? I mean, I guess I imagine it's hard for you to find staff members who want to do this work, and I think all of the health profession is struggling to find folks, but I guess I'm just wondering what it's like for you all and how easy it is to get people on board.
Yeah, thanks for that question. You know what, the challenge is more, so it's not hard to find people. There's actually a really beautiful thing that happens is that people engage in our services and then end up, setting goals of, hey, I want to do this work. I want to get to a place where I can do this work for people. And that's actually something really beautiful about us is many of the staff started in our services or we met them at the hospital and then here they are today. So they're modeling that. We do have a lot of people that come in and start to do the work. And what happens is because people are on their own recovery journeys, there's this very delicate balance of keeping themselves healthy and doing this work. So sometimes we do have people that have to step away, and that's the challenge, is that we'll have a really good worker who has to step away to take care of themselves. And do we put someone in that position? Do we wait for them to come back? And that's a dance that, as a person supervising a peer agency, it's challenging. That's like a lot of my work is just the health of the staff so that they can do this amazing work for the community.
Yeah, that makes sense.
I will add too, when we go out in the community, that the stigma is difficult when we're trying to hire. There is that within our community and people that know us, it's word of mouth that we're really successful bringing people in. But it is hard when we go out in the community and people don't understand who we are and what we do.
True.
I guess my one question and comment is, I think what I'm realizing is that people are, after the pandemic, people are kind of they're desperate and they're like at the end of their rope, and even people that might have been mentally healthy prior to the pandemic are really, really struggling right now. And it's almost like it's just been compiling over the years. And I've received 2 calls in the past week of people that are just absolutely desperate. They're desperate for their loved ones to either seek therapy. They're desperate for their loved ones to be able to receive the care that they want them to have, that not necessarily their loved one is ready to embark upon. And as caregivers, they're just absolutely worn out and on empty. Is there any service or help that you provide for caregivers?
And that's one of the things that we would recommend NAMI. I should stop and say, we actually absolutely would talk to people. You know what I mean? We've had a lot of parents, we've had a lot of caregivers, support people that, like you said, they don't know what to do. A lot of our services are a person who wants to be on their recovery journey, and we're gonna walk with them, right? But there are services such as NAMI that work directly with parents, and that's why it's so great with family members. Yeah, COVID was devastating. Shauna, I know you know that I lost a best friend, and I say that she died from COVID, from the loneliness, because she already had mental health issues, and then she was completely isolated, and she took her life because it was too much. And COVID has really, if there's a silver lining, right? I hate saying that, but it has made people start talking about mental health more. There certainly is funding that we're supposed to be seeing for more services, but it's devastating. And the epidemic of loneliness is devastating. Yeah. And so our agency, what's unique about it is that the first thing we offer is connection. So people can walk in, there's no agenda. We don't have to have you complete something or do something. You don't have to have your insurance card. Just come in and make connection. And that's what that outreach center, that's what that drop-in really is. Come in and see people and sit down and be seen. And that's a lot of what the social drop-in is. People just come in to feel that connection.
Great.
So important.
Travis Brooks?
Yeah, y'all's work is amazing, and I just want to say thank you. There's two pieces that you talked about that I just want to highlight and lift up. And one is your practice being rooted in harm reduction. I don't think that harm reduction gets enough attention yet, the attention that it should, especially with all the data that surrounds it. And the fact that peers have an opportunity to assist others, that's huge. You go through this journey and then you can have an opportunity to give back. And I have a lot of friends who spent years with substance abuse issues and found the opportunity to give back to others. And it's like driven them to be able to help others that dealt with similar circumstances. So that's a beautiful thing. I just want to thank you for the work and for lifting both of those because it's so important. Thank
you. Thanks, Travis. Yeah, sharing our own stories with people, it just creates a trust and and it opens possibility. Yeah, and as far as, I was 26 years ago, I was in that Cornell self-injury study, and I was just learning that my cutting or my self-injury was actually a coping, right? It was like a way that I was coping with such difficult trauma. And I didn't know that, or I'd never heard that, or no one, and then I was finally meeting people like me who were able to talk about that. And you would go to a therapist and they would be like, you have to stop this. You have to stop this. This is suicidal, and this is, and I finally was around peers who were like, no, we want to stay alive. And this is how I'm doing that, even though it looks so horrifying to other people. So to have peers and to be able to talk about those things is just so, it's so hopeful.
Thank you. Susan Currie?
Thank you very much for that presentation. I agree with you. COVID really had a huge impact. I'm wondering if you partner with the Office of the Aging, because I know in my district I have several seniors who are isolated, and I refer them to, try to connect them with the Office of the Aging that has great programs. But I know that that isolation over the past few years has really impacted some of our older citizens. So I'm wondering if you partner with them.
I wouldn't say that we partner with them. We do try to keep all the agencies informed about our work with seniors. In fact, there's a presentation that two of my staff are doing at Lifelong on Friday. We do have a senior support group that actually developed during COVID. It is a Zoom support group, and if you're interested in that information is on our website. But we have two peer specialists who work with seniors who are seniors themselves.
Great, thank you very much.
Amanda Champion?
Well, yeah, on that note, Lisa just raised her hand, but I wonder if your organization should come to the COFA advisory board meetings. I don't know, I don't think you have a seat on them, but it's a monthly meeting and lots of organizations, have a representative there.
Sure.
But I would look at Lisa if she thinks that's a good idea.
I think it's a great idea. And I didn't even mean to raise my hand, sorry about that. I was going to give you a thumbs up. that support group information, because that's, you know, we would give referrals to you guys as well. So it's good stuff, and I can contact you outside of this meeting and maybe get together at least for some presentations for our staff and other people so we know what's going on.
Yes, we try to have a wide variety of histories in our peer specialists, you know, so that people can work with people that, you know, have similar stories. So we often try to have people sitting on committees and I know that they might be interested, both of my people who work with seniors. So that's great.
Thank you.
So Josephine and Jenny, I just want to thank you for coming to our meeting today. You and your staff do incredible work for our community, and you truly are angels in my eyes. So I just want to thank you and just let you know that we really appreciate your work. Thank you.
Thank you so much. Thank you so much, John.
Thank you.
Thank you, everybody.
Okay, let's see here. Next on our agenda, we do have a few resolutions and some minutes, and then we'll do our department updates. Let's see here. We have resolution for a budget transfer, children with special care needs, early intervention program, ID 12431. Can I have a mover, please? Moved by Susan, seconded by Amanda Champion. And Frank Krupa is here. Frank, can you talk a little bit about this resolution?
Sure, thanks, Shauna. Yeah, the legislature approved an OTR for 2024 to allow us to hire 4.5 FTEs of service providers because we have seen a rapid decline in the amount of providers available in our community, which has resulted in wait lists for children. We did attempt to recruit for those positions, and we've only been able to actually bring on board, and I believe we'll be starting in the next couple of weeks, one speech therapist. So we were not able to recruit to fill those positions, but the need is still there. We did a survey of our current providers and some past providers, and the thing they pointed to most was the rate that they're being reimbursed at. So what we've brought back is a proposal, a hybrid proposal. One, we keep enough funds aside for the speech therapist that we've hired, as well as one other therapist position if we are able to identify someone to bring on board, but then to shift to a model of providing a stipend on top of the state reimbursement for services. So we're proposing a $25 stipend for all of the therapy services and a $50 stipend for the core evaluation services that are provided in hopes that we will attract more providers back to the EI program. We're doing all of this within the existing OTR amount. We're not asking for new funds. We're just looking to shift from staffing lines to contractual professional services lines in the budget.
Thank you. Are there any questions or comments for Frank? Okay, let's go ahead and do a roll call vote. Susan Currie?
Yes.
Amanda Champion?
Yes.
Travis Brooks, do you have a question or?
No, yes.
Okay. And I am a yes. That passes. Thank you, Frank. Next, we have a resolution authorizing use of staff recruitment and retention funding, ID 12386. Can I have a mover, please? Moved by Susan, seconded by Amanda. And Frank, can you talk to us about this?
Sure. This is a continuation of the state program to provide monies for staff recruitment and retention, namely bonuses. The previous money came to us directly from the state. This funding came to us as a Medicaid adjustment to our rate. And so we were waiting until we had all of the money in hand to be able to bring the program forward. So this will provide a bonus for certain titles within our mental health clinic from the Medicaid rate enhancement we received.
Great, thank you. Any questions or comments for Frank or the resolution? Okay, let's do a roll call vote. Susan Currie?
Yes.
Amanda Champion?
Yes.
Travis Brooks?
Yes.
And I am a yes as well. That passes. And then the last resolution, authorization to accept funds and budget adjustment, personal recovery-oriented services, the Department of Whole Health, ID 12398. Can I have a mover, please? Moved by Amanda. Sure. Seconded by Susan. And Frank, can you explain this one?
Sure. This is funding that we've received from the state. I believe it comes from the ARPA funds to our PROS program for outreach and community-based services. So we are looking to purchase a vehicle as well as some ancillary supplies for the program to be able to do that outreach and engagement and community service provision in our PROS program.
Great. Any questions or comments? Okay, let's do a roll call vote. Susan Currie?
Yes.
Amanda Champion?
Yes.
And Travis Brooks?
Yes.
And I am a yes as well. Thank you, Frank. And let's go ahead and approve the minutes for April 17th, 2024. Can I have a mover, please? Moved by Amanda, seconded by Susan. Any questions or comments or changes? Okay. Roll call vote. Susan Currie?
Yes.
Amanda Champion?
Yes.
Travis Brooks?
Yes.
And I am a yes. So the minutes pass.
Are we not doing that presentation?
Oh, gosh. Yeah, we do have another presentation. I totally passed you up, Frank. You didn't think you were going to get off that easy, did you?
I
Donna,
thought maybe.
No, not so much.
Saying anything.
it also looks like Mr. Brown has joined us.
Oh, great. Hello, Randy. Okay. If we could go back to the presentation, sorry about that, Frank, for the departmental opioid and overdose activities, ID 12410.
Sure, thank you. Before I jump into that, just to follow up on the question about SHARP, Shauna, you asked earlier, we do have information on our webpage at tompkinscountyny.gov/health/SHARPs, or you can just Google our webpage and search SHARPs there on how to safely collect, pick up, and dispose of SHARPs if you find them in the community. So just wanted to point folks there.
Thank you.
And then let me just bring up the presentation real quickly. Okay, so this was a presentation that I provided to the Board of Health at their last meeting in April, and Shauna had suggested that I bring it here to you all as well. It really was an attempt to kind of talk about the work that we've been doing over the last few years around opioids. I know there's a lot of talk about it, and obviously it's one of the biggest issues in our community that we're dealing with right now. And just wanted folks to be aware of what we're doing, what's out there as far as information. And you just know that, you know, we are obviously actively working to try to address the situation. One of the questions that came up was around our communications to the community. So going back about 2 years time, I just provided the different press releases that have gone out from our department related to varying issues around opioid and substance use disorders that we've provided to the community. There's links in the presentation to all of these. They're all on our website if you'd like to read them. There are a lot of links in this presentation, and so I'm not going to go into huge amounts of detail as we go through, but if you want to click at your convenience later on, you can get more detail about some of the things I'm going to be talking about. So this is by way of press releases and communications. You know, we've been talking about there being an issue around fentanyl in the street drug supply. I think the public commenter mentioned one of our press releases that, you know, shared information about the contamination of the street drug supply data that we were able to get from our community partner Southern Tier AIDS program. So we have, and we do try to provide information on a timely basis about, you know, what's happening in the community. I know sometimes we're not doing as much or as quickly as some might like, but we, you know, we definitely try to be thoughtful and, you know, make sure that when we are providing information, we know it's accurate, that it's important for the community to know, and is going to have its intended consequence when we do share it. So. As far as data, there's always a lot of question about data, and we have quite a bit of it on our website. We have an opioid section on our website, and it has a data link. And in that, we provide quite a bit of information there. There's some local data, the monthly 911 calls and the drug-related death data is local data that we're able to collect. So the 911 calls, of course, we get from Newark. And the drug-related death information comes from our medical examiner, which is part of our department. The quarterly reports and the opioid dashboard from DOH are, they are out there. There's a lot of great information, but they're a little bit further behind from a timeliness perspective. So they definitely paint a picture of what's happening in the community and can provide a lot of good, detailed information, but it does tend to be, in some instances, a couple of years old. Probably the most recent data that they provide to us is about 6 to 9 months old. So there's a lot of information, but it is sometimes dated. On the drug-related deaths, we've been providing the number of deaths every 6 months from the medical examiner from an intentional overdose death. And we've been doing that since we transitioned the program in 2019 to the pathology group at Cuyahoga Health Systems, because they've been really great about helping us collect data. Just recently, and I think I shared with this committee, we have released demographic data since 2019 on those individuals that did die from an intentional overdose. A couple of things that came out of that data. One, food service workers was the main occupation that was listed. So we're doing some internal thinking with our environmental health group who permits those food service facilities to see if there's a way for us to make some inroads there. And then, you know, I think we saw some things that we expected, that the age range kind of crosses the spectrum, and there, you know, it is impacting our entire community. So that data we're going to be updating now on an annual basis. And the reason for doing it so infrequently is the numbers are still relatively small. And so we are trying to be mindful of protecting people's privacy while at the same time, you know, trying to paint the picture for our community. The next step in our work on that front is trying to work with community partners, namely Cuyahoga Health Systems, to try to get overdoses that do not result in death, to get some data around those, because one, those are further upstream. There's still a chance to help those folks, and there's more of them. So we're hoping we'll be able to get kind of a bit more real-time data about the demographic population of folks using ED services in specific related to overdoses. I would also point out that there's a lot of data on the sheriff's website about the care team and the work that they're doing, and I believe IPD is also including care team data on their website amongst their data. So there's quite a bit of data out there. We know it's important to folks, so we're continually working to try to make available what people are looking for. On the community planning front, on the public health side of the house, we have a community health improvement plan that we work with the hospital system to complete every few years. And our current CHIP has promote well-being and prevent substance use disorders as an identified priority. There's some of the goals listed here underneath that the community is working on. I would point out that the CHIP is a community health improvement plan. It's not a departmental community health improvement plan. So we do work with partners, one, to build the plan, and two, to try to make impact on the identified priorities. On that same front, on the mental health side of the house, our local services plan is we are required to submit to the state, which is a prioritization of mental health, substance use disorder, and developmental disabilities issues in our community. And you can see the 7 that we've identified through that process: workforce, housing, crisis services, cross-system services, non-clinical supports, ACEs, and transition age youth. I think those first three are not a surprise to anyone. We're talking about them across a lot of industries, but I think we all recognize that those social determinants of health have a significant impact on the work that we're doing. So this is all done in conjunction with the Community Services Board and their subcommittees. So there are many community members that populate those groups that have a key role in helping develop this plan for us as a community. And then lastly, new initiatives, things that have been going on over the last 2 years. We've expanded our opioid overdose prevention program from just being at Green Street to Brown Road. So now across the entire department, we're able to access naloxone and be able to distribute that. If you were at the Better Together this Saturday, we were handing out Narcan at our table for people that needed it. So, and that was done through our health promotion team here at Public Health. So we're really excited to expand that. I've talked about launching the care team. And I do need to make you all aware when I'm done with this about a potential additional expansion of that with some state funding, so don't let me forget. We received pilot funds from OMH to expand the outreach worker program to the rural parts of the county, and thank you to all of you. We received an OTR to continue that after the funding from the state ran out, and we're in the RFP process right now of trying to identify a vendor to potentially do those services. We facilitated your work, the legislature's work of distributing the opioid settlement funds out to the community organizations, and there's a link there to the press release as to everyone that received those funds. And the local community services board also received opioid settlement funds, and our deputy commissioner led a process that created a rapid housing and crisis services program with those funds that I'm happy to say we are very close to having the contract signed with Catholic Charities of Tompkins and Tioga County to administer that program. So we're hopeful that in a few months we'll be able to bring them to you to give a presentation on what they hope to achieve and what the program will look like. So we're excited that that's coming on board as well. And with that, I'll stop, and I'm happy to answer any questions.
Anyone have any questions from the committee? Okay. Thank you, Frank, for bringing the presentation. Oh, sure. Travis Brooks?
Sorry, it took me a minute to find the hand button. Frank, you had mentioned that you all were working with Cuga Health to get some of that data. I would assume that there's other agencies that you're working with that see a lot of folks and collect a lot of data, do a lot of outreach. What are some of the other agencies that y'all are working with?
Yeah, on the data front, Travis, to be honest, we haven't gotten that far yet. Our prioritization early on has been the ED department because they're collecting a lot of data. They have people that's just what they do, and we thought we would be able to get kind of the largest numbers of people, with overdose where there's actually data connected to it because they're seeking a service. We fully intend to work with other community partners to find out what data they have, at some point in this process. So we're kind of just stepwising through. If there's someone you know of or an entity that you're thinking, hey, I saw they already have that data, let us know and we'll certainly reach out to them.
Okay, will do. I'll send you a few.
Great. And Sean, if I could just add one thing tangential to the report, I mentioned the care team. We're hopefully going to be bringing to you all a budget amendment soon in the next few months. The state has offered us some additional funding, about $300,000, which would allow us to add a third care team under their funding. There's some challenges to that. We would have to become a licensed crisis team separate from our current clinic, which means we have to do some maneuvering to make that happen. We're going to have to create some supervision outside of the clinic because you can't have clinic staff working in another licensed program. So we're working through some of the details on that, but we are looking forward to bringing that to you all. The funding is only for a couple of years, though, so I've already talked to Lisa about this, and I wanted to make you all aware as well, because I know it's going to be successful, and I know when the state funding goes away, there's going to be an ask at some point, do we want to continue to fund that, and do we have the resources to do it locally? So I just want to be completely transparent about that up front, but they're giving us funding, so it feels like we should take the effort to expand at this point. The sheriff and IPD are both interested, so we're still working through where that might actually land. And so you'll see a budget in a couple of months. I wanted to kind of give you guys a heads up that would be coming.
It's great news. So would this care team actually, I'm assuming it would wrap around the hours that the existing care teams, so it would have maybe some evening hours and weekend hours?
Yeah, I think there's some thought to do some of the hours that aren't currently covered around that. I know that Harmony's been talking with Under Sheriff Olin and IPD about what that might look like moving forward. But yeah, the intent is to cover more ground.
It's great. It's very good news. Any other questions or comments for Frank? Lisa?
I had just another item of follow-up, not on this issue, but earlier in the comments, the public comments that you read into the record, Shauna, there was a question that I think Frank could clear up for the committee. It was in reference to a question and comments that were raised at Public Safety Committee about crisis stabilization. And Frank, maybe you could update the committee. I think that folks would want to understand that here. Sure.
So I wish I had great news. I think we have okay news, but everyone's aware the Alcohol and Drug Council is no longer operating, and we're in the process of getting an RFP out for the services that they were providing. It was my hope that RFP would include kind of a joining of OMH and Oasis services. It doesn't seem like that's going to be possible at this phase. So the RFP that is with Oasis right now, waiting their approval, would be for substance use services as they were originally designed for the building on Trip Hammer Road. We had a call today with OMH leadership to say, look, this is what we're trying to do. The county's committed. There's funds available. We want to be able to do this. So they're on board as far as agreeing that it sounds like a good idea. They're going to talk to Oasis to see if there's, what it might look like and what barriers might be in the way. What I will tell you is that any resources for OMH crisis stabilization, which is actually a duly licensed program between Oasis and OMH, also has an RFP process. Those RFPs have already closed, but my understanding is that there are some that may not be awarded, and there may be another opportunity in the near future to apply again. So right now what we're doing is the RFP for detox and stabilization for substance use disorders should be going out, I'm hoping, in the next few weeks. And then once we get a vendor selected for that, then we'll be having conversations about how do we bring in the OMH side of the house? How do we bring in the mental health stabilization? What can we do with that facility? Is there space there? Can we meet the regulations for this other RFP in anticipation of potentially applying for that opportunity? Now, I know the county has earmarked money with Cuyahoga Health Systems. Obviously RFPs are competitive procurement processes, so we don't just get to say it's DHS. I know they're interested, and so hopefully they will submit an application to the RFP, but we will have to go through a formal selection process. And once we get to the other side of that, we'll be in a better place to say, okay, what this might look like together. But it is still our vision to try to bring it so we have a singular facility that can do, the spectrum of care from detox to stabilization for substance use, and also have the mental health stabilization component built in.
I think my concern is just that we're on a really tight timeline for these funds to be spent. And I mean, we've done this with other agencies who have known that they can't meet the timeline. We've kind of put those monies back in the pot and allocated them towards other vendors. And I know that, no one wants to do that. However, we also don't want to waste $1.5 million that we've allocated if the timeframe's not going to work. So.
Yeah, the timeline that we're under is to obligate the funds by the end of the year and spend them by the end of 2026.
Okay.
For ARPA.
I
Still a tight
do think
timeline.
the potential still exists for that to happen, but I also am not promising it, right? Because these things have a way of, particularly when there's so many state agencies involved, they are aware that the county has committed those funds and there are timelines associated with them. Like I said, I do think there's a possibility we can still meet those timelines and do what we want to do, but I can't promise.
I think I'll talk to Dan, Chair of the Community Recovery Fund, and maybe there's a contingent plan of if they can't have, it secured by November or October or something, the funds go to this, because I feel like we definitely need a backup plan. So, does that sound all right with everyone on the committee? Yeah. Okay.
Yeah, I agree.
Okay. Thank you, Frank. Appreciate the presentation.
Thank you.
And next, why don't we just go to the departmental updates? Frank, do you want to give a quick update on mental health, or whole health, shall I say?
I think you've gotten the same big things that are going on. I will tell you, we have a lot of RFPs in the works. It's a lot, and we're doing our best to work as quickly as we can through all of them. And just ask everyone to be as patient as possible because the load has increased dramatically recently.
Okay, thank you. Any questions for Frank? Okay. Lisa Monroe from the Office for the Aging.
Hi.
Hey, Lisa.
Not too much of a report. I just wanted to mention we had our annual meeting luncheon on May 3rd and recognized our outstanding volunteers, older adult volunteers, that is, Bridget Hoverman and Nancy Schaff. And yesterday, NYSOFA celebrated Older New Yorkers Day in Albany, and all the outstanding volunteers from all the counties were invited to attend that. And I'm pretty sure Bridget Hoverman went to that, so I haven't touched base after, but yeah, so she was able to be celebrated up there as well. Our annual report is online on our website, and it's also, there's hard copies in the office if anybody would like to see that. Otherwise, we're just gearing up to develop and submit our 4-year plan to the state, which is kind of colliding right along with the county budget season. So that's a little bit of a challenge for us when that happens. But yeah, we're just getting ready and preparing that budget as well. So
Great.
That's what we're doing.
Thank you. Any questions for Lisa? Amanda Champion?
Not a question, just thank you for the great luncheon, and the speaker was wonderful. I definitely got a lot out of it, and it was great to see a crowd there in person and enjoy some food. They gave us the biggest piece of cheesecake I have ever seen in my entire life. I mean, I don't think anybody ate their whole thing, so just saying.
It was a lot of food.
It was a lot of food.
For sure. Yeah, it was a great event. It was so nice. This was the first time since COVID, 2019, we've been in person again, so it was really great to have that. So thank you.
Oh, nice. Okay, thanks, Lisa. Next, Ken Clark from the Office of Human Rights.
Good afternoon. Today at 6:30, we will be hosting an in-person event which is focused on analyzing the migration process under current U.S. immigration policy. That will be at 6:30 tonight at GIAC, and our speakers will be Jacqueline Kelly Widmer from Cornell Law School and Crystal Osmond from Miller Mayer, who's an immigration lawyer. We will also be sending out save the dates shortly regarding the County City Juneteenth event, which will be on June the 19th from 11 to 3 at Southside. That will also include, as it has for the last 2 years, a Black Business Expo and a keynote address that will be delivered at lunchtime by DeQuetta Jones, who is the Chief Executive Officer of an organization in Syracuse, Vera House, having moved here from the Capital Region within the last couple of months. And also to our second annual Democracy Fest, we'll be sending out a save the date for that. That will be August the 6th from 6 to 9 p.m. in front of Southside. We had a very successful inaugural event last year. We scheduled it on August the 6th because that's the day in which the Federal Voting Rights Act of 1965 was signed into law, in which efforts are being made have been made unsuccessfully up to this point to restore key provisions of that act, which are related to enforcement. So those two things are coming up, and STDs will be going out toward it, or I should say, no, that sounds, save the dates will be coming up for both of those events.
Great. Gay Pride is coming up in June. Is there anything that's planned for that?
We are planning to have a film showing this coming year. It's called My Name is Paulie Murray. That is the plan. We are putting the pieces in place regarding Paulie Murray, who was a lawyer, one of the first African-American women priests to be ordained to ministry in the Episcopal tradition, but also a member of the LGBT community and a person whose jurisprudence was seminal and influential on people such as Ruth Bader Ginsburg. So we are working out the details in terms of the time and the location for the showing of that film.
Okay. Any other questions or comments? Susan?
I just wanted to compliment the Human Rights Commission on the program that they offered on Monday night,
Yes.
which was on YouTube, and I think that'll be available for viewing. It was a really good panel discussion about women's experiences in healthcare for non-white women. There were some eye-opening and incredible stories, and it was well attended and took quite a bit of organization. So thank you to the Human Rights Commission for that.
Yes, thank you, Susan, for mentioning that. I was about to mention that just before you spoke, but I'm glad you did. I mean, it was a very powerful event organized by the Human Rights Commission, in which we heard, really, it was the centering of women's voices and their lived experience in terms of dealing with issues of sexism, racism, and other forms of injustice as they have sought to get either health care for themselves or to be able to practice. And so it was, very powerful. And the narratives of women speaking of their experiences was really, it was superbly done.
Great. Thank you, Ken. Any other questions? Okay, thank you very much.
You're welcome.
Let's see here. Next, we have Teresa Albert from Youth Services.
Hi, good afternoon.
Hi.
Not much to report. We're very happy. We finished up the last couple of weeks of interviews for our youth services specialist position, and we are hoping to offer it to someone next week. So then we will be an office of 4, which we will definitely are happy to have someone new come in. But that's about it.
Great, thank you. Any questions for Teresa from Youth Services? Okay, thank you, Teresa. Appreciate it. Let's see here. Next, we have J.R. Claiborne from Veteran Services.
Okay, good afternoon, everybody.
Hi, J.R.
Can you hear me? Okay. Have to try to catch up with the ever-elusive mute button, so making sure. Good afternoon. Busy time this month, although not quite as much as March, which I'm very thankful for. Right now, we're currently collecting information on events for Memorial Day. Just coming up the end of this month, I want to be able to update my website that I have, my page that I have set up for Memorial Day. Also, just as an FYI for you all, this past weekend, we were expecting delivery of the flags for that'll be distributed to the, throughout the county to mark the graves of the veterans across the county. And that's something that is done courtesy of the celebrations budget that's now under my department's supervision. Last month, I had my second appearance in the VSO Insights, which is a new occasional series that was started in cooperation with Cornell's Veterans Colleague Network Group. And this is something that explores various benefits and issues in the veterans community. So it's kind of fun to be able to do that. It's I basically put on whatever the topic is I talk about, and then steel myself for the Q&A that comes afterwards, which is kind of fun because sometimes there's some questions there I really have to tell them let me get back to you on that. But it's really something where we all learn some things, and I've gotten a couple of thank yous afterwards for veterans who were able to access some new benefits that they didn't know they were aware of. This Friday, we're going to have our third meeting of our Women Veterans Group. That'll be at 3 o'clock here in our building in the Human Services Annex. I do want to take a time to say last month, for our second meeting, I want to give a public thank you to Danielle Brookman and the staff at the VA clinic. Danielle is the clinic administrator there. And we were there because the women in our Women Veterans Group had questions about VA benefits and VA healthcare for women. And so Danielle and her staff were willing to be gracious hosts for us, so we were able to just move our meeting up there, which was really cool. They got to learn some things, and I learned a little bit because I came in after the meeting, kicked myself out during the meeting. But it was really fun to have that, and so we're looking forward to really trying to gain some momentum with this group because it is brand new, and trying to find our women veterans is not an easy task, so really hoping that this will be something that gains some traction over the coming months. And then next to last, I had a special surprise last month that I received. I went to the monthly meeting of the Vietnam Veterans of America 377 chapter, and in the middle of the meeting, they called me up front, and I don't know if you guys can see this, but okay, it doesn't work well on Zoom, but it's a certificate of appreciation for contributions and service to the Finger Lakes chapter of Vietnam Veterans of America. So that was a nice thank you for them. They were particularly happy with the our event for Vietnam Veterans Recognition Day at the end of March. But they were really just thankful for a lot of things that my department's been able to do in support of their efforts. So that was really nice that they presented that to us and a card signed by the whole chapter for the staff here. That was cool. And then lastly, segue and appreciation is this is National Military Appreciation Month, and it's meant to raise awareness and encourage celebration and appreciation of those who serve and have served in the armed forces. So I just want to throw it out to everybody. And at this time, the end of the month, we want to be thankful for the sacrifices of veterans who are no longer here, but also this is the time to acknowledge the veterans and the active military who are here.
Great. Thank you, JR. And congratulations.
Thank you. That was a really cool surprise.
It's wonderful. Any questions or comments for JR? Okay, thank you so much.
Thank you.
Next, we have Kit Kephart from Department of Social Services. Hi, Kit.
Hi, everybody. Thank you, Shauna. So we, just kind of a quick update. We have currently 98 people, individuals in homeless shelter services, 87 adults, 11 children. May, kind of on another topic, May is National Foster Care Month, so we celebrate that this month, as well as next month when the weather's a bit more predictable, we will be having an outside foster care recognition picnic for our foster care families. And we are always, just to kind of put that out there, we're always looking for new foster parents. If people are interested, you can check out the county website under Foster and Adoptive Services, and there are contact numbers there. We're always looking for families, particularly for families that can help with children that are older, that are in the pre-adolescent or adolescent teenager ages. We always really need foster families. And lastly, just kind of a quick update. The State Office of Children and Family Services is piloting a new software program that we will be engaging with starting in the middle of June. It's called Binti. It's a new software program that will hopefully help expedite foster parent applications and streamline them, make them a little bit more user-friendly. So we're excited about that, and that'll be getting up and running shortly. So, so those are all good things that are happening at this point.
Thank you. Any questions or comments for Kit? Okay, great. Thanks, Kit. Appreciate you coming. Okay, I think we are at the end of the meeting today, and if all of you will just look at the budget adjustments and transfers. Those are just for information purposes only. If I could have a mover to adjourn. Moved by Susan, seconded by Amanda. All those in favor? Okay, thank you all. Have a great day.
Take care.